In the last 110 years, life expectancy in this country has increased by 31 years. While most people think medical care is the major reason we are living longer, the fact is that 26 of those 31 extra years of life are because of our public health efforts. Efforts that focus on prevention activities that benefit everyone in the community, not just those with money or health insurance. Those issues are diverse and complex, including things like clean air, water, and food, climate change, occupational safety, injury and violence, food and housing insecurity, educational and health disparities, and criminal justice policies, to name just a few. To effectively address all those issues, the involvement of people from a variety of backgrounds, sectors, training, and expertise is required. In Minnesota, over the last 110 years, there's only one multidisciplinary public health organization that routinely mobilizes all these constituencies to work together to better the health of the public. It's the Minnesota Public Health Association. On today's episode of A Public Health Journal, we'll be talking about MPHA and celebrating its 110th birthday. Please stay tuned.
Welcome to A Public Health Journal, a program that explores the public health issues facing our society today and tomorrow. The host of our show is Dr. Ed Ehlinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health, the Hennepin County Human Services and Public Health Department, and the Minnesota Public Health Association, all working together towards the goal of healthy people living and thriving in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at the role of the Minnesota Public Health Association, or MPHA, in identifying and addressing the major public health issues in our state. This will be a special conversation because MPHA is celebrating its 110th year of service to the people of Minnesota. Joining me in this conversation are Lindsey Fabian, current president of MPHA, and Becky Sechrist, president-elect. Ms. Fabian is employed at the University of Minnesota's Division of Epidemiology and Community Health within the School of Public Health, and Ms. Sechrist is a planning program supervisor at the Minnesota Department of Health. These two individuals reflect the fact that to make Minnesota the healthiest state possible, multiple organizations and numerous individuals need to be engaged in collaborative and cooperative efforts to protect and promote the health of all Minnesotans. Becky and Lindsey, welcome to our program.
Thank you.
And happy birthday to MPHA. Lindsey, you're the president right now, and so tell me a little bit about why MPHA is needed today, in the current Minnesota world.
Today, MPHA is needed now more than ever. Like you said, we've had 110 years, and we're still active, we're still growing, and we are still responding to what Minnesota needs in terms of public health issues, helping our students grow and become the next set of public health leaders, and now working on health equity issues, as you mentioned in the beginning.
Right. And Becky, how have you seen, as you've kind of looked back, how have things changed with MPHA? Is it the same needs? Are the issues different, but the needs are the same? How do you see this over the 110 years of history of MPHA?
I think the needs are absolutely different. I mean, as MPHA has grown, so has the context in which MPHA has existed. I mean, so when the organization first started, it was, sanitarians going out and, protecting, communities, whereas now we really have grown into a very population health focus and looking at, immunizations and how can we protect entire populations, environmental health. And so really MPHA functions within the context within which the organization currently exists. And of course, that's not remained static in the last 110 years.
Yeah. So who belongs to MPHA? What does your membership look like? Lindsey?
Our membership is very diverse from all across different parts of Minnesota. Students, like I said, public health professionals, people who work in academic settings, government settings, local settings, healthcare, industry. Really, everyone is welcome. We would not ever turn away a member. Yeah.
So now the two of you actually in your real jobs, because MPHA, the work there is voluntary, that you do that on your own personal time, but you work, Lindsey, you work for the University of Minnesota School of Public Health, and Becky, you work for the Minnesota Department of Health, have major roles in public health. How does being part of MPHA add to what you do in your regular job? Becky?
Well, it's an opportunity because MPHA is an advocacy organization. It allows me to think about the work that we're doing at MDH and how we can push that out to different communities and to different sectors that we work with at MDH. It's really broadened my perspective and my view on how we can take ideas, new learnings, evidence-based practice, data, and be able to share that with as many people as possible. And now I have a different avenue to do that.
Mm-hmm. Lindsey, how about you?
And for me, similar, but more the research into action. So I work on federally funded research grants for most of my day at work in specific areas, and MPHA allows me to do advocacy in so many more areas than I do at work, and to help see research into action, really into policy, and working with policymakers based on the work we've done at the University of Minnesota and elsewhere.
Yeah. So you don't need to be an employee of a governmental public health agency to be part of MPHA.
No.
So I suspect you have people from other sectors?
Absolutely, and I think that's preferred. I mean, I think that's really the way public health does its best work, is when all people that are interested and that have a dedication to the health of the public are coming together. And I think, you know, in my role at MDH, working with MPHA has really allowed me to get to know different communities and get to know different people and share ideas and thoughts and bring those ideas and thoughts back to MDH, because it really is a two-way partnership, two-way street. We need to be sharing information back and forth.
Now, there are a couple of other organizations that influence public health in this state. The Local Public Health Association, which is the directors of local public health. How does MPHA interface with LPHA?
We definitely work with them. We partner with them on some advocacy issues. We've partnered with them on some work with MDH in creating videos to help share with policymakers what public health is, telling the story of public health. We work with all sorts of people across the state who are doing local work, city work, community-based organizations. We welcome all partners, and we thrive on partnerships.
And I know when I talk about public health, I always say it's a three-legged stool. There's a federal, and when I talk about governmental public health, a federal role, a state role, and a local public health role. And I think the same is generally when we look at public health more broadly defined, not just governmental public health. There's a national influence, a state influence, and a local influence. And the organization that really has that national influence is APHA, the American Public Health Association. So how does MPHA relate to APHA?
I think, again, it's that two-way street. So we are able, as an affiliate in the state of Minnesota, to bring the ideas, the needs, and the work that we do and kind of level that up to the national scene, as well as, we get information being an affiliate with APHA on, what's the news on the street, what's going on at the Capitol, what are we hearing, and where are the kind of winds blowing when it comes to federal legislation that regards public health. And so we really are trying to cross-purpose that information and share it.
Yeah, Lindsey, do you have any examples of Minnesota actually influencing APHA? I know, we've been leaders in a whole variety of things.
Yes. In fact, right now they're looking to Minnesota for the work we're doing on climate change. They're looking to Minnesota for the work MPHA is doing on gun violence prevention. And some of our policy statements we're sharing nationally with the other affiliates, the other statewide affiliates who want to do work in climate change and gun violence prevention. And they're looking for a model, and they're looking to Minnesota for that, as well as our Great Lakes Coalition. MPHA is very active in the Great Lakes group and is a role model for other affiliates and how we join up with other states.
And I know workforce is always a big issue, and we have in Minnesota, our public health workers are getting to be, a little bit older. And does MPHA a good place for people to get in and get oriented to public health at a young age and work their way up?
Absolutely. We've seen a great rise in more undergraduate public health programs throughout the country, and Minnesota is not an exception. And MPHA is taking an active role in reaching out to those universities who are creating undergraduate public health programs and other graduate public health programs, and creating partnerships and bringing in more students and organizational memberships with other universities. And students are our future, and we definitely realize that. We offer great student rates. Many of our events are free to students, or at least have a very discounted registration rate. And we always welcome students on our board.
Yeah, I think I would add too that I think students can come into an organization such as the U or MDH, to do their graduate programs and things like that for credit. MPHA gives a volunteer opportunity, which I think has a different feel to it than if you're actually doing work for credit and trying to advance your actual, towards your actual degree. And so those volunteer opportunities, there's leadership opportunities, there are opportunities to get out into the community and work with those different groups, so that provides a different avenue for students involved.
Is there some mentorship engaged in all of this?
Yes, I believe there is.
In fact, to add what Becky said, many of our committees have paid internships, so not only students can get volunteer experience, some of them can get paid and do great work for their resume and to build their future in public health.
All right. Now, I know as part of the 110th birthday celebration, you put together a little videotape that is going to be shown at the annual meeting of MPHA, and we're going to show that now. But it really using a lot of the stuff that we've talked about on this program. Being a past president of MPHA, I've always been trying to get MPHA involved. So we're going to take we're going to take about 7 minutes or so and look at this video, and then we'll come back and talk about it. So let's roll this videotape about MPHA and its history.
Welcome to this special celebration of the Minnesota Public Health Association's 110th anniversary. My name is Lindsey Fabian, and I am the current MPHA president. Over the next few minutes, let's take a look at the highlights of MPHA's past work and talk about our organization's future direction. The images and video clips shown here are part of the MPHA records collection now housed permanently in the University of Minnesota Social Welfare History Archives Library. Special appreciation to Minnesota's Commissioner of Health, Dr. Ed Ehlinger, for his donation of a public health journal tapes and DVDs used in this video. We hope you enjoy this presentation.
In Minnesota, there is only one multidisciplinary and independent public health organization that routinely mobilizes all these constituencies to work together to better the health of the public. That's the Minnesota Public Health Association. We'll be talking about MPHA and some of the many public health issues with which they are actively involved. Please stay tuned.
Minnesota Public Health Association, or MPHA, has been around since 1907, so we're over 100 years old. We are an affiliate of the American Public Health Association, or APHJ, which is based in Washington. And here in Minnesota, we're Minnesota's independent voice for public health. And as you said in your introduction, we bring together lots of different organizations and people from all aspects of public health and bring them together, and that's how we can stay as an independent voice.
Historically, public health in the early 1990s to the 1960s was primarily made up of health officers, public health nurses, and sanitarians. MPHA has gone through major eras, revitalizations, future direction planning, and capacity building as an organization supporting independent public health in the state of Minnesota. Throughout this period of time, we've had regular communications with members. We've held annual meetings on emerging issues at the time. MPHA has also created special task forces based on issues at the time in order to find evidence for policy or program change recommendations. We'll highlight just 4 achievements with video clips from a public health journal, program tapes, featuring past presidents of MPHA.
A lot of things were happening in the 60s and 70s, major changes. And the minor consent law was needed because minors at that time could not consent for their own care.
Professionals in the Minnesota Public Health Association and the Minnesota Medical Association, who at the time said, we need to address this gap in statutory language. We need to have it made very clear that we can carry out our professional responsibilities to patients. And that's why the Minnesota Public Health Association said, we'll take it under our umbrella.
MPHA was very involved with the passage in 1976 of the Community Health Services Act. This state and local partnership contributed to the good health outcomes that Minnesota had over the years.
And what is the extent of violence in our society, in the United States society today?
It's a public health emergency. 17,000 actual reported cases of maltreatment. Now this is for children.
Dramatically, the population's becoming much more diverse than it was before. We've got some serious health challenges in parts of our population. I want to talk just for a second about disparities in health status. We have been rightly proud of our health system in Minnesota. We always enjoy high rankings for quality of care, longevity, but underneath that average, there is a very disturbing range. We don't do nearly as well in protecting the health of populations of color in this state as we need to. And we needed to attend to that as the population becomes more diverse.
With this glimpse of where we have been, let's focus on what makes MPHA special and some of our current activities.
Health should be part of everything that we do in terms of making decisions about policy, but also program creation, all these different things that go on.
And so MPHA can be a way to complement and support people in their public health practice. We want to really continue to improve how public health is practiced in the state. Secondly, partner around addressing social determinants of health, which is a larger part of the pie that influences how healthy we are.
Public health and health has never been more relevant. It should be on all of our agendas, no matter what we're doing. And organizations like MPHA help further that agenda and infuse that concept into all we're doing.
As Dave and Carol discussed, MPHA is currently active on a number of different fronts, including health and all policies and health equity. We keep ourselves current by offering an annual policy forum series and conference. In the last 2 years, one forum series focused on health equity from a number of different dimensions.
There are families out there who don't have stable housing. And imagine that you have to go and sleep in somebody's house and put the baby next to you on a sofa, or put the baby in bed with you, and then you roll over the baby. Not because you probably didn't make the best decision necessarily, but because of, the circumstances within which you live.
We continued this focus with our annual conference themes for the past several years. We advocate for legislative policy change through annual lobby day with our partners. We network through participating in conferences and events of other public health related organizations. We've always had fun together too. MPHA has done creative activities such as the 1996 Torch Run through Minnesota, our Centennial Celebration Gala in 2007, and these are just 2 examples. Recently, we've expanded our networking focus to include volunteering in the community with our members. Events have included Mississippi River cleanups, food shelf distribution help, community walks for stroke awareness, and more. Throughout this work, we've kept our connections to past presidents who are valuable individually and collectively as a vibrant group.
As a volunteer-driven organization, MPHA members are crucial to shaping our future direction. As we've seen throughout our history, MPHA members are our essential social capital. Members are spearheading new direction for MPHA, guided by our multi-year strategic plan. And we've formed a global health committee, a health equity committee, and our policy and advocacy committee are now focusing on new emerging issues such as gun violence prevention.
MPHA would have never survived without our foundational partnerships with the Minnesota Department of Health and the University of Minnesota's School of Public Health.
Additionally, we are thriving to accomplish our mission in collaboration with many other partners, from coalitions to professional groups to public, private, and nonprofit organizations. Now more than ever, all voices are needed so MPHA can remain a strong, credible voice for independent public health in Minnesota. Please join us. Happy birthday, MPHA.
Welcome back. We're talking about MPHA on its 110th birthday with Lindsey Fabian, the current president of MPHA, and Becky Sechrist, the president-elect. From that video, what jumped out at you? What were the things that really struck your attention?
I am proud of all that we have done in 110 years. We've come a long way, and as many of the speakers commented, we have a long ways to go. A lot of issues to still work on in Minnesota, and MPHA will be here to work on them.
Mm-hmm. And I think what strikes me, as we've already mentioned, is, the different views, the different pictures, and the different partnerships, and that it's everybody coming together for the good of the public and for the public's health that makes MPHA pretty special.
Yeah, and what jumped out at me, is the leadership that for the state that has been part of MPHA. A lot of the people there, and we've only got about 30 years of history on that tape. These are the people who ran organizations who have been influential in policy, and they've been part of MPHA, so you've had a big impact, haven't you?
Mm-hmm. Definitely. Yes.
So what do you see now as the issues that, we talked about a little bit about equity and climate change. Lindsey, what are you working on? What are the things that are really the focus of your year as president of MPHA?
Well, a couple different avenues. One more housekeeping avenue. We have grown enough financially to hire some part-time staff, which is huge for our organization. For years, we've been all volunteer, and our volunteers are our biggest asset and do all of the work for us. But now we have a part-time staff person who can really help us move issues along, help us with more grant writing and bringing in other sources of income so we can continue to do the work we want to do, as well as Our members wanted a health equity committee, so we responded, and two wonderful people are co-chairing our health equity committee, and they are really working on the issues that are important to all of us in Minnesota. Social determinants of health, how where you live matters, where you eat matters, where you go to school matters. That's what they're working on. And our Global Health Committee is taking on some refugee health issues, immigrant health issues, as well as global health issues. So those are two examples of ways MPHA has changed in the last few years to really move us into the future.
And Becky, in your year that's coming up, what are you planning on focusing on?
Well, I mean, there's the sustainability of everything that Lindsey just mentioned, because you know that's what our members have said, that's what they need, and we need to continue moving those forward. I think, you know, an emerging issue is funding for public health, and I think as we look at the federal landscape, you know, there are some, you know, kind of iffy waters that we need to tread through, and even here in the state of Minnesota, I think there are some changes that might be afoot. The funding for local public health and community health boards is not as robust as it once was, and the needs of public health, you know, have changed, and I believe that we are not quite keeping up with those needs, and so whatever we can do as an organization with MPHA to advocate with our state legislature to ensure that funding is increased in the not too distant future, I think is a role that we can play.
Yeah, and then thank you for bringing up that issue, because we're really at a crucial time in public health. We're at the federal level and at the state level. There's this question about what is the role of prevention, what is the role of government, what is the role of individual responsibility, and policies are being shaped around that, and funding is being shaped around that, the role of the private sector and the role of the public sector. How does MPHA, and these are issues that cross the political spectrum, you know, at least in my view, they should be non-partisan issues, but how does MPHA deal with some of those policy issues, sometimes that are partisan in nature?
That's a really good question, and I think one we've been probably struggling with for 110 years as an organization. I think two things. One, telling the story of public health, telling people's stories and how policy affects their lives and how changing policy can really help them. As well as a number of our public health policies, I think we need to show a financial side and an economic side. How can some of our public health ideas create jobs? How can they help rural Minnesota? How can they help urban Minnesotans? How can what we're doing help every Minnesotan? So when we all get better, we all get better, right?
Yep, I couldn't agree more.
Yeah, and what the other issue that always is in this state is the urban-rural divide.
Right.
And you know, is MPHA statewide, and do you have representation from various parts of the state, greater Minnesota?
Yes.
And how do you keep those issues front and center?
Absolutely, yes. We have members from across the entire state. And I think, you know, we do our best to take the work that we do and not just do things in the Metro 7-county area. So the annual conference and meeting that we have mentioned a couple of times goes to greater Minnesota every other year or so. And so we really try to draw people in from the different parts of the state so that it really is a statewide effort and not focused just in the metro area.
And I suspect climate change and water quality are issues that you address. How do you relate to the Minnesota Environmental Health Association, which is also a public, an organization related to public health issues, some of the environmental health issues? How do you relate to that organization?
A few years back, we actually did a joint conference with them at Grandview Lodge near Brainerd, and that was very powerful to bring public health people and environmental health people together. And we've done some encouraging to be cross-members of each other's organizations. That's an area we can continue to work on.
Right.
Yeah.
Now, as we get near the end of this, how can people get engaged with MPHA, and tell us where some of these archives are going to be? First, the videotapes that you have and a lot of the historical things that you have from MPHA, where is that going to be housed?
As the video mentioned, all of our records are now housed in the Social Welfare History Library at the University of Minnesota. Thank you to them for storing all of our archives for us, as well as almost 600 episodes of a public health journal are also stored underground there. And we will continue to add to those archives, and that will be the living history of MPHA right there.
Absolutely.
Yeah.
And I was going to say too, I mean, membership notwithstanding, I mean, we have a public website. People can go look at, understand what the current issues are in Minnesota and what MPHA's focus is for priorities for any given year. So in addition to becoming a member, which is always greatly appreciated, we absolutely want people to learn about public health, and our website is a way to do that.
All right, so Becky, you're going to be the president moving forward. What does the future of public health look like in Minnesota?
Well, I think it's bright, but I'm the eternal optimist. So I think that, as long as we keep fighting the good fight and believe in, serving the public and encouraging everybody to do their best to take advantage of the opportunities to be healthy, we're in a good place.
Good. Well, I like the fact that you're representing MPHA, but also representing the university and MDH, where the major organizations come together to move up public health in the state. That's why Minnesota is a healthy state, because we have a lot of people working collectively, as the IOM says, to assure the conditions in which people can be healthy. So thank you for your work, and happy birthday.
Thank you.
Thank you.
And I'll be back with a closing comment right after this message.
Today, kids, I am going to teach you how to stay safe during flu season. If you are feeling sick, stay home. Cover your mouth if you cough or sneeze. Wash your hands consistently throughout the day. And remember to get vaccinated. Got that?
Yes, Ms. Lee. It may seem repetitive and, well, elementary, but this flu season, remember basic prevention. Protect yourself and others.
Although we have state and local health departments that are charged with providing a variety of public health services, public health is not just their responsibility. Public health is the responsibility of all of us. Public health is not just a place of employment, it is more of a philosophy of life. If you're concerned about the overall health of your community, if you think health is both an individual and societal responsibility, if you think being well means more than just being physically healthy, or if you'd rather prevent a problem than treat it, then you're a public health worker. No matter where you work, you can advance the health of the public by promoting programs and activities that improve the overall health of the people in your community. And all of us need to be public health workers, because as the Institute of Medicine said, public health is what we as a society do collectively to assure the conditions in which people can be healthy. People working together can do a lot more than individuals working alone. And if you want to have some great partners in that effort, join the Minnesota Public Health Association. So today, as we celebrate MPHA's 110th birthday, and every day, celebrate public health and celebrate your role in making Minnesota a healthier place to live. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.